Good afternoon and welcome everybody to the City of Yarra Community Forum. We'll just wait for people to join us. My name is Jon Faine and I've been invited, and I'm honoured to have been asked by the City of Yarra to host and to moderate this important community discussion. There's another one this evening, and we'll just wait for people to join in before we formally start the proceedings. So we'll just spend a minute or so while people join us. We're expecting a significant number of people. I'm looking down, we've got nearly 70 people so far, and as they come in, we'll just wait for more people to join us, and then we'll get started, and I'll introduce the Mayor, who will officially commence the proceedings. You don't need me to tell you it's been a most extraordinarily difficult, nearly 2 years now, at least 18 months. And lives have been turned upside down. All of us, every single person, not just in the City of Yarra and Melbourne and Victoria, but right around Australia and right around the world, everyone's lives have been significantly challenged by this extraordinary pandemic. We may have been a little slow on the pickup and the take up. We may have been complacent. Some of our experts, I'm sure, who are joining us in a minute will have something to say about that. But in my 40 years now of being publicly engaged and 30 years of working at the ABC, I've never known an issue, never known anything, not 9/11 or Princess Di or anything else, to have had the same level of community engagement, connection, curiosity, insatiable appetite for information. It's just been incredible. Well, we've got a fair swag of people, so I think we'll kick off. We're only a minute or two after the intended start time. And if other people join us, well, they're going to miss the very, very beginning. I'll introduce you to the speakers shortly, but first up, in order to officially commence the proceedings, I'd like to welcome the Mayor of the City of Yarra, Councillor Gabrielle de Vietri. Thank you very much.
Thank you kindly, John. I'd like to begin by acknowledging the Wurundjeri Woiwurrung people as the traditional owners and the true sovereigns of the land now known as Yarra. We acknowledge their creator spirit, Bunjil, their ancestors and their elders. And we recognise the strength and resilience of the Wurundjeri Woiwurrung, who have never ceded sovereignty and who retain their strong connections to family and clan and country despite the impacts of European invasion. Yarra City Council also acknowledges the significant contributions made by other Aboriginal and Torres Strait Islander people to life in Yarra. And we pay our respects to elders from all nations here today and to their elders past, present and future. Hello and welcome to this community forum. It's an event brought to you today by the Yarra City Council, and we're hosting these forums to address the low vaccine uptake occurring across the City of Yarra and beyond. We hope that the forum promotes informed discussion and helps people who might be on the fence about the vaccine by giving them the information that they need to make a decision in an empowering and non-judgmental way. I think we all agree that what matters is getting back to doing the things we love, that we get back to enjoying our vibrant and diverse local community, we get back to supporting our local businesses and experiencing everything that Yarra and Melbourne and beyond has to offer. And most importantly, what also really matters is that we get back to reconnecting with our friends and family. I'm looking forward to enjoying long dinners with friends, hugging grandparents, meeting new babies. I'm sure you all are. I'd like to acknowledge and thank Bway Tai, the Deputy Chairperson of the Victorian Multicultural Commission, for being here today. And I'd also like to thank our esteemed panel members for making the time to be with us today. So Dr. Simon Slaughter-Khan, MD and Public Health Physician at Putukunu Aboriginal Medical Service, Dr. Shobana Nambia, Emergency Department Doctor at Bowen Health, Laura O'Shea, Project Coordinator for North Richmond Community Health's COVID-19 program, and Anthony Tassoni, the Victorian President of the Pharmacy Guild. We're very privileged to have all of you here today to share your expertise and your knowledge, so thank you so much. We're also really lucky today to have Melbourne lawyer, broadcaster, writer and local resident Jon Faine here to moderate what will no doubt be a robust discussion. Jon is very well known to many Victorians, having hosted the agenda-setting morning show on ABC Radio Melbourne for more than 20 years. Thank you so much, Jon, and over to you.
Thank you very much, Mayor. And in addition to paying my respects to the traditional owners of this land, I'd also like to express my personal impatience for a treaty or treaties in order to try to address some of the terrible mistakes that we've made in this country in the past, without which I personally don't think will ever be complete. Let's move on though. There are some serious puzzles about the low vaccination rates in the city of Melbourne and Yarra, and today here we are to discuss and to try and address the low vaccination rates in the city of Yarra. The latest figures, if I can give them to you, and this comes from a point of love. I've lived in Yarra now for 40 years, ever since I was a student and left university and moved into the inner city. And this community has extraordinary strength and resilience, but there's a complete puzzle, there's a mystery at the core of these figures that I'm about to share with you. As of Monday, the most recent figures, in some parts of Yarra, there's only a 65% first dose vaccination rate. That compares very poorly with other parts of metropolitan Melbourne, and particularly poorly with other parts of this state and other parts of New South Wales. I mean, the ACT are up around the 90% now. So we're here because of that. It's a bit of a puzzle. There's about 25,000 people in the city of Yarra who have not yet gone off to either make an appointment or have their first vaccine, which means it's at least another 3 or more weeks before we get to a double vax rate that's required in this part, this vital part of this vital city. So ever since March 2020, we've been dealing with COVID, but here we are now in the middle of October 2021, still trying to do the most basic thing, which is persuade people, for whatever reason, to overcome their hesitancy or their anxiety or whatever it may be, and that's what we're here to talk about, in order to get the one thing done that will get us out of this: vaccination. So there's a 4-phase plan. I'm not going to go through it all. If you're unfamiliar with it, we can make information available to you, but it's very easy to get. You can go to any pharmacy, any doctor's clinic, and if you don't get the vaccine straight away, any of the community clinics, you certainly can get the information that you need and someone who can talk to you. But that's what we're here for today. The people you can talk to are on this panel. So the forum, we have a lot of questions that have already been sent to us, which we'll address, but there's also an opportunity for us to take additional questions between now and 1 o'clock, and again this evening for the session for people who aren't available in the middle of the day. So I won't go through a lengthy introduction to our 4 experts who have so generously given us their time, because the Mayor's told you who they are, and I'm going to ask them to, in a way, introduce themselves as a way of explaining their connection and how they've been involved in dealing with this unprecedented health crisis that's affected us all. So I'll start, if I may, with our emergency physician expert. Dr. Shobana Nambiar, as you've heard, works as an emergency physician. She lives in the inner north. She's homeschooling her kids as well as juggling the extraordinary emotional and professional demands of dealing with this particular emergency. And Shobana, if you can start off and telling us how you got involved and how you see our progress so far in this particular crisis. Thank you. Let's unmute you first.
Oh, sorry. 18 months later, we're still on mute. Thanks, Jon. And thank you so much to everyone to make the time to be here and talk about this important issue. It's very close to my heart, obviously. Yeah, I've been working in emergency over the 20 years, but in the last 18 months while we've faced this pandemic. And I think, you know, as in emergency medicine training, we train to be adaptable, to adjust to unexpected, urgent situations that are rapidly evolving, multiple patients who show up all at once. Even in that context, though, I think all of us would say this has been some of the most challenging times of our career while we deal with this virus, which is so contagious, so dangerous for our patients, and really so different from influenza and other respiratory viruses that we've faced before. And it's been incredible and a privilege to watch the team come together to deal with this. But I think it's also undeniable that we're tired, and that spending the whole day in PPE is fatiguing and dehydrating. And there's a huge cognitive load going on while we adjust to the almost daily changing COVID protocols that we're learning as we progress through this pandemic. But I wanted to share that I think for me, the PPE and the COVID and the homeschooling, I think despite all those things, the biggest challenge has been watching people come to emergency and having to drop off their loved ones and leave. And for those people to be alone in our department. And we all completely appreciate that the day you come to emergency is possibly the worst day of your life, or certainly one of. And we know that that emotional support is just as important as the physical treatment that we can give you. And without a loved one to hold your hand and sit by the bed, it's incredibly challenging, and it's hard to see that. And I spend a lot of my shift on the phone to multiple family members, updating them and trying to keep them in touch with their loved one and trying to pass messages on. And that's sad and hard to watch. Yeah. But what I can say to everyone here overwhelmingly is that those patients who are coming to us with COVID, who are sick enough to need to come to hospital or certainly to ICU, are those that are not vaccinated. And that is incredibly clear watching our colleagues in New South Wales and now in every ICU in Victoria. So we're really saying we are working so hard. We want to get to everyone as soon as we can, whether they've got COVID or not. But if you get vaccinated, the chances your illness will be mild and you can stay home and be managed at home and be with your family.
Okay. Shobana, thank you very much. And that's coming from, someone who's right there at the coalface, as is our next guest. Dr. Simon Sloter-Khan has a long career working in Indigenous health, working with disadvantaged communities, and he's also been on the consultative panel for the Victorian State Government response. Simon, your connection and insights, please.
Yes, I'm a long-term resident of Yarra as well, and I've lived across Burnley, Abbotsford and Clifton Hill, and most of my extended family is still living in Yarra as well. And I work in Indigenous communities, and I worked in the State Health Department as well. When it started for me was that when I was working in a student health service in Melbourne, we were having students coming in that we were having to test. These poor students were having to go out and do all the deliveries for everyone else and do essential work. And then we were testing them and finding them positive in our PPE, of course, and that. And it was really sad to see them kind of being locked up at home, not being able to get any income. A lot of them were really, really struggling through that. So that's where it started. And then really when I looked at it, how it personally affects people, like Shobana said, it was when in my now departed grandmother's nursing home, when COVID got in there and there was no staff to look after them, there was no medications, there was no food going out to the people that were there, they didn't get their dressings changed. It really kind of came down and saying, like, you can get really sick with this, and it's really going to have a huge impact for the whole community if we don't protect ourselves. It's really good that we really have a good way, a safe, effective vaccines to protect ourselves, protect our families, and protect the whole community. And that option is there for all of us. And I think people are really taking it up, and Yarra's been a bit slow, but when you offer it to people and you go to where people are and you talk to them, they're really, really interested in protecting themselves, their family and the community. And I think that's the message going forward, that we've got these great effective things to do it. And the tragedies we've been through on the first wave, and now with our cases at the moment of around about 20,000 active cases in Victoria, which is really sad, that's going to impact us for quite a way to come. And as Shobana said, 91% of people in hospital are unvaccinated. So if you vaccinate yourself, you protect yourself, the community and your family.
Thank you, Simon, and we'll have questions for each of you and Shobana in a moment. But Laura O'Shea is a community nurse. She manages the high-risk accommodation response at the North Richmond Community Health Centre and has a background in intensive care nursing and a long history of working with the communities, particularly in the Ministry of Housing Estates, and has been crucial to the rollout. And we're going to hear a very successful rollout through those ministry estates. So Laura, explain to us what you've been doing.
Thanks so much, John, and good afternoon, everyone. That's right, I do have a long history of working in this community, and I also live in this community with my young family and also share the challenges of remote learning for multiple young children. North Richmond's response on the Richmond housing estate started back in July of last year. We had a crisis on our hands, and we responded collectively as an organisation and also with our partners at the City of Yarra. And thank them for their ongoing support of our programs and the department, state government. And off the back of this crisis, and we had, I think, 52 positive infections at that time, which was incredibly challenging for our workforce. We then were commissioned to run a local project called the High Risk Accommodation Response, which is run throughout Victoria, but we focus on Richmond, Burnley and Cremorne. And we support over 5,000 residents in sort of identified vulnerable living conditions such as high rise because of their density, low rise public housing, rooming houses, community housing, etc. And so we've been working alongside these communities for the past 13 months to build incredible trust. And our model, I believe, has been so successful because we employ such an amazing team of predominantly community staff directly from the Richmond Housing Estate who speak over 15 different languages. So we have been walking alongside this community to sort of educate, provide information, sort of alleviate some of their concerns and anxieties around vaccination, around staying so COVID safe. And I think that's been our success story. And I can proudly say that the vaccination rates in all of the Yarra Towers, including the areas that CoHealth, our partners, are responsible for at Fitzroy and Collingwood, are extraordinarily high and certainly at state average, if not that being perhaps a conservative estimate of where we're at. So we are incredibly proud of the work that we've done. And I would sort of say that I think the resilience of these communities is nothing short of astounding. And what I observe every day is that they see that this is not just about them and whether they feel that it's right to get vaccinated. They also know that they have a duty to their communities to get vaccinated. And so I think that's my take-home message, is to consider it's not just about the individual, it's about the impact that has on community. And so that will just be my leaving point for the moment.
I'll come back to you soon, and thank you, Laura. Anthony Tassoni is the Victorian president of the Pharmacy Guild. There are, I think, 12 pharmacies, or maybe even more, that you can get vaccinated at in the city of Yarra. And the rollout through pharmacies, when it finally happened, in my personal view, somewhat belatedly, has been a crucial improvement in getting higher vaccination rates around Australia. He's also a community pharmacist. And tell us about your involvement and your colleagues' involvement before we get to questions. Thank you, Anthony.
Thanks, John, and thanks for the invitation from the City of Yarra. I'm delighted to be here. And you're right, John, it would have been great if pharmacies were involved earlier. I feel like we're the super sub off the bench coming onto the field late in the game to try and help the team get the vaccination rates up. And we've had over 1.1 million vaccinations delivered from community pharmacies across Australia, and about 250,000 COVID vaccinations have been delivered from Victorian pharmacies alone. I'm one of those vaccinating pharmacists in my pharmacy, working weekends, doing whatever we can to promote access to patients to be able to get the vaccine. And what I'm seeing is a very diverse range of patients coming in, children and school-aged kids from 12 years and up, mums, dads, older patients. And I have to say there are people coming in this week who are really reluctant to get the vaccine and doing so because of mandatory vaccination orders from their workplace. But what I look at it is it's every conversation with a patient is an opportunity to promote how important vaccination is, not just for themselves, but they can share with a co-worker, a family member or a friend. And I really enjoy each and one of those conversations. And we thank every patient that does get vaccinated and let them know that they're going to be in the stats at the end of the day, ticking up towards to get to those benchmark targets to get back to the things we love and miss. So I'm really excited that pharmacies are a part of it. It's a real team effort. We need all hands on deck. And like a game of sport and like a game of football, whatnot, it is a team sport, and we need repeat efforts from people. When it's your turn, it's your turn. We can't stand back from the contest and wait for other people to get in there. The team needs you and the game chooses the moment for you, not yourself. And this is life. The life is choosing the moment for you, and we need you. And I know, and I'm really enthusiastic that people are coming forward and they're rolling up their sleeves and they're encouraging co-workers and friends to do so. And we're so close, Victoria and City of Yarra, and I'm pleased to be part of the team.
Thank you very much. And we'll see if there are questions that come your way as well. Mayor, if I can come to you, Gabrielle, and to pick up on the sporting theme, the football theme that Anthony's inviting us to take up, and I'm guessing he's probably a Collingwood supporter. Why are Collingwood at the bottom of the ladder?
Look, I don't know the specific details of why some groups are less, have taken up the vaccine slower than others. We are working very, very closely with the Department of Health to try and figure out where the gaps are. But there's no specific data that's available to tell us why. We know the facts, we know those figures, but we don't know exactly why. And there's likely to be a whole range of factors impacting the low in uptake across Yarra. Things like misinformation among some people. Yarra's younger age profile means that residents didn't necessarily have access to a vaccine until recently. I booked as soon as I could, and I rebooked 3 times to get an earlier appointment, and I only just got my second jab this week with much relief. And the latest data does show actually that we're struggling a bit with uptake in Richmond as well.
Yep.
I think there's a few things to consider, and I think digital and health literacy also plays a part. And the problem does seem to be consistent across the inner city. And that's something that we all need to take responsibility for. And of course,
certainly the City of Melbourne's figures are even worse than Yarra's, and the next one of the worst other municipalities is St Kilda, which shares a similar demographic profile. But Laura, the initial assessment was that it was the people in the high-rise towers in particular who were hesitant and reluctant. But in fact, your work has proven that's not the case, in which case the higher than average take up in the high-rise towers in the Ministry of Housing Estates means that there's a lower than average uptake in the rest of the municipality of Richmond and Collingwood. Do you have a theory?
I think Gabriella's point about access perhaps being a sort of shorter period of time for younger people across Yarra is a valid one. I think that there's still, we still have some pockets of hesitancy that we're working on, and we're tailoring our vaccine clinics to sort of to meet that and acknowledge those really genuine sort of feelings that people have, a concern. But I think our effort has been really consistent over the last 13 months to provide accurate information on the ground, our community staff and our clinical staff walking alongside them. So I think that information is everything. It is empowering in being able to make the right decision. And perhaps that's not been afforded to all people that live in Yarra, but I urge you to acquire and equip yourself with as much knowledge that is accurate about the vaccines, and that's what we're all here to do today.
Okay, so you work a lot with migrant communities, and you've been very successful in turning around a low response to a high response. What would work? What's the main argument or explanation or information that brings people across and persuades the hesitant? Let's look at the target group, particularly young people. What is it that most seems to be effective?
I think it's the human story, John. When people understand, it's touched the lives of everyone we work with at Richmond Housing Estate, and they have family that have been affected by this. So even when they felt hesitant, they've realised now is their time to step up. We've had some more tragic news this week with the sad death of a well-known community member in Yarra, and that's, I understand, has tipped some more people over to come forward and get the vaccine. And I just, my background in intensive care nursing as well, and I just can't stress enough, we don't want to wait for another death or the death of a family member for that to be your reason that you get vaccinated. It's just, it's not the time now. Right. And so I think it's that emotional story, John.
Okay. Shobana, people were worried about clotting and they were worried about AstraZeneca. Is that still what you're hearing? Is it still the hesitancy based on those early concerns, or has it moved?
Yes. Yes, John, I think that is still a concern for people, and I think that's completely understandable given what's been in the media. All medications and vaccines can have rare side effects, and it's important to talk about those. I think, as an example, more recently, the attention has been on the pericarditis, which is an inflammation of the lining around the heart. which can happen more in our young male population. I'd just like to give some perspective to that though. There's a study in JAMA where they looked at 2 million people who'd had Pfizer, and they had about 57 cases of this illness, which is about 2 or 3 in 100,000. So if you think if we gave Pfizer to everyone in the G, maybe 2 or 3 people would get this. So that's very rare. And I'd like to reassure people too that we have very clear, streamlined pathways in our hospitals to pick up these side effects. We're very aware of them. And in the vast majority of cases in this pericarditis that we're talking about, it resolves on its own and it's not a life-threatening complication. And so I appreciate particularly parents are concerned about that. That's very understandable, but I think we need to understand that the risk of those things from getting COVID is a factor of 10 or more higher than the risk of getting these illnesses, these complications from the vaccine.
All right, and Simon, when you're trying to overcome hesitancy with people who may have, as Laura's explained, a low level of health literacy, what is it that's getting them across the line and overcoming their hesitancy that you can share with the 116 people who are listening to us now to learn more about the problems?
Well, so one thing is GPs and pharmacists have a lot of knowledge about the vaccines. These vaccines are really well known. We're lucky in Australia, we've got the Therapeutic Goods Administration that has gone through all the vaccinations, looked at the side effect profiles, looked at millions of doses. For example, even for AstraZeneca, we've had 12 million doses across Australia. So we know what effects they have, we know who they protect, and we know if there's something that may not be right for you. So asking your GP and having health professional advice is one thing that really helps people. Having people that they know, so a GP that you regularly know or a pharmacist that you regularly know, helps people get across the line. The other thing is that I talked to probably Laura's point there is family and friends that have had the vaccine. So if you talk to your family and friends that have had the vaccine, they really, really encourage other people. And once people see that and people in their network, they really understand what the risks are and they really understand what the possible side effects are, and they're really keen to protect their family, friends and the community. So it's actually ourselves and non-professionals going out and telling people and saying, I had the vaccine. I had a little bit of a sore arm for a couple of days. That was the main side effect I had, which is about, most people will get that, and that's about it. Occasionally, some people get a kind of a little bit of a flu-like illness for 2 or 3 days, and they're the main side effects, and they're really mild, and we know that really well from millions of people that have had the vaccine.
Anthony, the relationship between the community and the pharmacy is a very intense one, and the pharmacist is often the gatekeeper to a lot of health information. Are people coming in and asking for specific vaccines, or is it they just want any vaccine, it doesn't matter what it is?
We have people who are happy to get whatever vaccine we have available, and the message that we've tried to promote throughout is the best vaccine is the one you can get today, and there is plenty of supply now of the Moderna mRNA vaccine, which is very similar to Pfizer. So Pfizer is available from GPs and state vaccination clinics. Pharmacies have AstraZeneca and Moderna. And then state vaccination clinics have AstraZeneca, Pfizer, and maybe a bit of Moderna. Patients come in, they might want a particular vaccine. Some are happy to get anything, and some are still unsure whether they're going to get it at all. And it's an opportunity to have that discussion. People may see their pharmacist more often than other health professionals because of our accessibility. And we just invite you, ask your pharmacist or your GP if you're unsure. We're here to help. You are not an interruption to our day. You are the purpose of why we went and did years of study and do the things we do. We are here for you.
All right, well, let's move on. We've got lots more questions still to deal with, but there's some specific medical concerns people have. And Shobana and Simon, if I can draw particularly on your medical expertise to overcome some of the hesitancy that we feel. People are worried, for instance, people who either are or want to be pregnant. Shobana, is there any reason, or Simon, whichever of you wants to answer this, when it comes to pregnancy, either anticipated or actual, is there any reason for hesitation?
No, we've got a lot of information about pregnancy. The Therapeutic Goods Administration has looked at this really closely for Australia, and that's really good. And they've found that millions of women have had the vaccine. There's no risk that we know of to pregnancy or breastfeeding. The recommended vaccine is Pfizer for that, and that actually the risks to a woman from catching COVID while they're pregnant, of having a miscarriage, of having an adverse effect really high just from catching the virus. So the risk and benefits are very clear from overseas and from Australia that protecting yourself with a vaccine will protect yourself and your baby during pregnancy. It's recommended at all stages of pregnancy. Did you want to add anything, Shobha?
Completely agree. Just echoing that pregnant women are very high risk when they get sick with COVID, and that's something to really consider. And the other thing is, and I think this has been in the media a bit, that there's no connection between any of the vaccines and infertility. I think unfortunately that myth did get out there, but there's absolutely no evidence that any of the vaccines decrease a woman's fertility.
Although there is some emerging evidence that the disease can contribute in particular to male infertility or erectile dysfunction and the like. Has that ever been established, or is it just part of people maybe even being mischievous or humorous in trying to encourage people to overcome their hesitancy?
I haven't seen studies from that. Yeah, so I don't think we've got the study evidence for that so far. Shobha, is that right?
I personally don't aware of it, but long COVID or the long-term side effects of COVID are a well-documented thing, and I think there's a lot of evolving evidence about those. Okay. Yeah.
Those concerns, which are incredibly important. Anthony, diabetes, people worry about all sorts of, I'm a diabetic, I'm dependent on insulin or whatever it might be, or I'm taking tablets for all sorts of other things, and I could rattle off a list a mile long. How well equipped are pharmacists and how well researched are the intersections of these different sorts of medications?
There are so many reasons to get vaccinated, and there's very few reasons that you can't. So what we call the contraindications, so the things that stop someone from receiving a medication are very narrow. I could count them on one hand in terms of if you've had an allergic or serious reaction to a first dose of one of these vaccines, or an allergic reaction to one of the components or ingredients, or very, very rare blood or bleeding disorders, may be reasons why you cannot have one of these vaccines. But in terms of any chronic condition that you may experience or be diagnosed with is not a reason generally to not be vaccinated. They're all the more reason to get vaccinated, because you might be at greater risk of some of the impacts from COVID. And just to add to the excellent commentary from the other panelists about safety in pregnancy, mRNA vaccines, both Pfizer and Moderna, are considered safe, and a lot of evidence to know that they're safe throughout all stages of pregnancy and breastfeeding. And for any viewers of the webinar, if they've had a first dose of AstraZeneca but have since fallen pregnant, speak to your doctor or pharmacist, because you can get your second dose, being an mRNA, in those particular instances so that you're fully vaccinated. So talk to your doctor or pharmacist. And my wife, as a shout out to all midwives out there, my wife is a midwife at Monash Medical Centre treating COVID positive expecting mothers. There are lots of impacts on unborn babies for potentially with COVID, and there is no reason not to get vaccinated for them. Please, if you're planning pregnancy or are pregnant, get vaccinated.
All right, I'm just scanning through the questions, Shobha. There's a fair few people asking a variation on the same question, which is, I've had COVID. Why do I need now to get injected? I shouldn't need the vaccination. I should be immune.
I think that's a question for everyone to discuss with their individual doctors, but in general, as I understand it, not an immunologist, the recommendation is to still get the COVID vaccine, and that the immunity that you get post having actual COVID doesn't last as long. I'd be open to other panelists joining me on that, but that's what I understand the evidence to be.
All right, yep. Simon, do you want to add to that?
As well? Yeah, so the only thing you'd consider is talk to your GP, because you might have a time period before you have the vaccination, because you don't want to be suffering from long COVID or other things while you're being vaccinated, but you don't get enough protection from getting the disease itself, actually, that lasts a long time.
All right, and if indeed you've had a COVID test and you've come back negative, but you're still in quarantine because of close contact, should you wait and not get vaccinated until your quarantine period's over? Who wants to answer that? Laura?
I can talk to that. You should certainly wait, please. Please see out your quarantine period. It's vital in keeping the rest of us safe. If you are a primary close contact, so you don't have COVID, but you are isolating for 14 days, What you need is a day 13 test, please. And then once that comes back negative, you're free to go. And then you can book in for your vaccination. If you are positive, and this policy has just changed in the last sort of 24, 48 hours. If you are positive, you need to see out your 14 days from when you were tested. And then at midnight on the 14th day, you are also free to go. So because the system's so overwhelmed, they can't clear everyone. So it is a big advantage, actually, the way they've changed this.
All right, thank you. There's a question here from, and the whole point of this is you can ask anonymously, and several people are. Some people are putting their names to their questions, and we want to thank both of those categories. There's no kind of, there's no pressure on people to put their names to it. But this question, I'm only hearing about the emotional reasons to get the vaccine, but what about side effects? There's a 99.7% survival rate, unless you're very old or have significant comorbidities. So the side effects affect more people than the morbidity rate. So how do we explain that there's more to it than that? Simon, do you want to deal with that?
Yeah, so as we've talked about it already, actually, the side effects from the vaccine are extremely mild that you get for 99% of people, so it's a bit of a sore arm. So that side effect is really mild compared to protecting yourself, the community and your family from getting COVID. As we've talked about before, 91% of people in hospital at the moment with severe COVID disease are unvaccinated. So it's interesting to say that actually it's hopefully you won't be one of the unlucky people that need to go to hospital, but if you are one of those unlucky people that go to hospital, having the vaccination will make a big difference to your disease. You'll have a very mild disease. You won't be spreading it to other people. And the very mild side effects that we get from it are actually something that's worth having for that protection for yourself, the community and the family. I don't know what others think about that. Yeah.
I'll just add there too, Simon,
Sure.
and I'm sure Laura, as a previously an ICU nurse, would say that although our survival rates from ICU in Australia are good, and that's an absolute testimony to the excellent critical care that's going on, I think mortality is really a very blunt marker. It's only one marker of the effect of COVID, and a prolonged hospital and certainly a prolonged ICU admission. There was a very brave 17-year-old girl speaking on ABC today about her period and having a tracheostomy and a tube into her throat. And she survived that, which is absolutely wonderful. But there's no doubt that that will affect her for months and years to come. So I think we should look not only at the actual percentage of death, but the effect on you, your family, of a prolonged hospitalisation, your children, as a much broader measure of the cost of COVID to all of us.
Alrighty.
I couldn't agree more, John. I just sort of wanted to say that, I mean, once you enter the intensive care unit and you are intubated, it sets off a whole barrage of other really big problems for you and your system. The other thing I just wanted to sort of point out is that currently in Richmond and certainly over at Fitzroy and Collingwood, we are continuing to manage outbreaks. They are fatiguing our teams, and what we're seeing is, in a positive news story, that the outbreaks are much more contained than they were this time last year, and the people that are actually getting COVID are predominantly, so sitting around that same 90%, they're predominantly our unvaccinated groups, and they're just the small pockets we continue to work with. So we're seeing that people that are double vaccinated, despite living in high density living, are not actually even getting COVID. So this is very pleasing.
So we can distill it down to saying, sure, you might not die, but you're very likely, if you're unvaccinated, to be amongst those who catches it, gets sick, and if you have to go to hospital, you could be in for a very rough ride, even though the hospital might save your life.
And can I add, John, too, I think we need to understand that as an emergency, whilst the pandemic's been going on, car accidents haven't stopped, heart attacks haven't stopped, strokes haven't stopped. Kids are still bumping their heads on the playground equipment. Little babies are still getting gastro. All that kind of thing goes on. And you may not get COVID seriously, and I desperately hope you don't. But if you're unfortunate enough to fall off your bike going on one of your hours of exercise, you want to come to an emergency department which doesn't have massive overwhelm from other people who have COVID. And so I really think taking a broader perspective is really important.
Yep. And further, John, we don't know the number or how to quantify long COVID, but people who have suffered serious impacts from COVID infection for months and long-term afterwards. There was a young gentleman by the name of Will who spoke at one of the daily press conferences with the Victorian government, really articulated that. So as we get back to the things we love and enjoy, whether it's community sport or going to the theatre or different things, some people who have experienced long COVID may not be able to enjoy those things because of the impacts they've had from the COVID infection. So we can't stress enough. Don't wait, mate. Don't hesitate. Vaccinate, please.
And the thing about long COVID is no one knows how long it is, or it doesn't seem to follow any clear pattern. Anthony, while I have you speaking, there is a question, and I've lost track because I've been scrolling through them and it's a bit further back in the history, saying, well, but this has all been rushed. The development of these vaccines, all of them, it's been rushed. And I'm still this person who's asked anonymously the question, and we respect all the questions, and this is all being done in a very constructive frame of mind. I'm anxious about the fact that it's been rushed. How do you reassure me that I'm not taking a risk having something injected into me that hasn't been observed over the many years that some vaccines take to develop?
Yeah, sure. It's a great question. And as Simon referred to earlier, our Therapeutic Goods Administration, or TGA, is a medicines regulator that takes a lot of care in reviewing evidence and data from overseas before approving anything to be allowed to be given to a patient in Australia. And the way I'd sum it up is crisis brings cooperation in terms of collaboration amongst researchers and universities and drug companies to work together. Huge investment of money to develop these vaccines quickly. People willing to put their hand up and say, I'm willing to receive the vaccine and to be a subject of an early trial to see whether this is safe and effective. In clinical trials, things can take a long time conventionally because of money, because of resourcing, and because of people willing to participate. Those barriers were broken down in a global pandemic. So what we got here, and red tape was reduced through some of the approval process, not rushed, but there was attention to it. So I'm really comfortable.
It just went from the bottom of the pile to the top of the pile.
Yeah, exactly.
That's all.
And we were quite fortunate here in Australia, being on our island, quite insulated from COVID coming here, but being able to observe hundreds of millions of people actually receiving the vaccine and the vast international evidence to make really informed decisions whether it's safe for Australians to receive it.
Mary Beth in Swinburne asks you, Simon, you've mentioned the vaccine decreasing the chance of spreading the disease. Now that I'm vaccinated, am I less likely to spread it even if I get sick?
That's absolutely correct, Mary Beth. Yeah, so the vaccine is being shown to reduce the rate of yourself catching the COVID virus yourself. And because you're reducing the risk of yourself catching it, that reduces the risk to other people. The second thing is, if you do get COVID, you get a very mild disease, you're less likely to produce lots of virus that you can have spread to other people. So those sort of things make a big difference to the amount of spread. Even with our new Delta virus, it's actually been very effective, as we've seen in New South Wales, for example, with their high vaccine rates, at pushing down the numbers of cases because it actually reduces your infectivity.
Okay, let's deal with the elephant in the corner of the room rather than pretending it's not there. Shobana, mandating vaccines in many now occupations, not just a few, but many, has quite clearly had a bit of a blowback effect. And even if it's only 5%, let's say, of the overall population, it would seem it's concentrated in particular areas. How do you reassure the person whose almost emotional reaction is, you can't tell me what I have to do with my health? How do you overcome their hesitancy?
Yeah, that's a challenging question, isn't it? As a healthcare worker, I've had mandated vaccines all my life, and I'm sure everyone on the panel would agree. There's lots of mandated vaccines has been part of our world for a long time. This is not a new idea. It would be new for some sectors of the population, definitely. I think what we'd love is to work with encouragement and education rather than having to mandate. That's why these forums are here, and we're so grateful for everyone coming. We'd like to reassure everyone, like I said, that the side effects that have been in the media are very rare, and we are managing them carefully, and the mortality from those things is extremely low. I guess there'll always be a pushback about being asked to do something you don't want to do, like we mandated seatbelts and we forced people to put fences around pools in their homes, and that's dramatically decreased childhood drowning in my career.
Bicycle helmets.
Restraints in cars, baby restraints in cars has dramatically, if you talk to the doctors at the children's, they'll say that's had an incredibly important effect on child mortality. These are things we force people to do and they save lives.
Okay. And that works. Laura, is that working as well? Or do you find with your community, Laura, is there also a financial equation, which is, well, if you don't have it, you're not going to be able to work or participate in a whole lot of parts of the life of the community?
Absolutely, John. I think many of our community have been really affected by these rolling lockdowns, number 6 we're up to. And I think it's been the final push for a few people to come forward who are still sort of sitting on the fence and a little unsure. The mandating is sort of working in our favour to just gently encourage them to come forward. And they might still feel a little bit reluctant, but they're accepting. And it's also around the enjoyment of life again and going to pubs and travelling, all those things that we want to do. You're going to need to have a vaccine to do those things.
Simon?
Yeah, I'd agree with that as well. So the mandating is only for a very small minority of people it's actually going to affect, which is kind of interesting because you'd say 80% of people have already agreed to have their vaccine, and really that number keeps going up. So really it's the acceptance from the community is really high. And unfortunately for these things that can affect the whole community, such as speed limits, seat belts, smoking indoors, we've had to kind of look at the good effects for health on the rest of the community. And we just kind of weigh up that risk and benefit for everyone in the community to protect them.
Yes, I'm old enough to remember people smoking on aeroplanes and in cinemas, although I suspect the rest of you have only ever heard about it, but that's because I'm getting very old and ancient, but there we go. So Anthony, take us through. You're getting people coming in off the street sometimes. What's motivating them now, and what are they saying about the mandating? Is it helping or hindering the effort to get higher participation rates?
It's certainly increasing vaccination rates, and there's some genuine anger and discontent. There's no doubt from people who are subject to these orders to maintain their job. But when I speak to them, first of all, I thank them for being there and how great it is that they have come. And immediately they're thinking, well, I have to, I don't have a choice. But I said, look, but what you're doing here is allowing me to give you something that is going to help protect you, your family, and your community. So thank you. And I try to take the opportunity to reassure them as such. And I think with the mandating of these vaccination orders, it may be like a stages of grief type piece, that we start off with anger and denial to start with. And then hopefully as we transition, that there is an eventual acceptance. And we all have a role to play, whether it's health professionals, family and friends, in doing that, because it is truly a team effort to get to a vaccination level that we call herd immunity, that we all together as a team help protect each other with that level of vaccination protection, and our immune systems built a defense against this virus. So it is a series of conversations, and you have to tailor the conversation to the person and try and relate to them on their level.
Well, it's very hard to talk to 23,000 people one at a time, which is why we're doing forums like this one. And we hope that every one of the over 100 people participating also then share what they've learned with everyone in their circle. Important question, and Shobana, I'll ask you this one. I hear people close to me, this is an anonymous question. I hear people close to me saying that the vaccine will change my DNA.
Yeah, thank you for that question. I have heard that too. That's actually not the case. The mRNA that's in the vaccine is in the cytoplasm of the cell, and it never goes into the nucleus of the cell, which is where the DNA lives. So it's actually not able to get in there, and it's not able to affect your DNA. So unfortunately, I think that myth did get out there, and I have heard that in multiple places, and it's sad to hear that, but I do just want to reassure everyone listening that it can't change your DNA. It just doesn't have the capacity. I don't know if you want to weigh in on that, Anthony.
No, you're absolutely right. So what messenger RNA or mRNA vaccines, the way they work is the vaccine delivers basically like a recipe and set of instructions to the body to produce a like fake imitation piece of protein that resembles the coronavirus itself. So when the body sees this little bit of protein, it says, hold on a minute, that's not meant to be here. We're going to develop antibodies so that when we see the real thing, we know how to fight it. It's like training the body and practicing the body. So when we're game ready and when we see the real thing, we know how to fight it. We can put up a Dusty Martin, don't argue type to fend off the tackle and keep playing. That's the way I try to describe it to people. And that messenger RNA gets quickly broken down by the body. Once it's delivered the message, it goes away. It does not enter the nucleus of the cell and have any interaction to your DNA makeup.
Okay.
Absolutely assure our viewers of that.
I think it's Christian Petrarca who you refer to now. Dusty's very much in decline, but moving on. Emily asks, if your immune system compromised, I'm 75, asks Emily, which is the best vaccine for me? Who wants to jump onto that one?
All the vaccines are good if you're immune compromised, because you're at higher risk of catching COVID from other people and getting sicker with it and ending up in hospital. So at the moment, all the vaccines are available and they're good. So Moderna, Pfizer, and even AstraZeneca would offer you really good protection. And as Anthony has said before, even someone with diabetes, for example, the protection you get is much better than any possible side effect you can get from it. So all of them are good for you.
All right. And there was a question that someone asked about the human rights aspect of all of this. I've encountered this a bit even in my own circle as well. And I must say, having been a human rights lawyer, I worked at Fitzroy Legal Service for 3 years and have been involved in community law pretty much all my life, even as a broadcaster. Having been involved as a human rights activist and lawyer for most of my 40 adult years, I'm somewhat amused by people who have suddenly discovered human rights when it comes to, for the first time, a vaccination. They haven't seemed to be concerned about human rights until now. They haven't lifted a finger about anybody, let alone their own human rights until now. But suddenly it's a reason not to do something that protects their neighbours, their family, their friends, their colleagues, and everybody else around them. Have any of you got any reflections on this furphy, I think it is, of a human rights argument? Laura?
Couldn't agree more, John. I could not agree more. This is not just about the individual, as I said before. This is about your whole community, and if it's not for you, it's your community service. You owe it to the people around you to take this step. And John, I know you'll go to the others about this, but I just want to touch on the fact that it was mentioned that Richmond and Collingwood have got low rates in Yarra. And if people are worried about access, can I just give a plug to CoHealth and North Richmond's community-run vaccine clinics, who both have incredibly good availability for vaccines, probably on the day, the next day. You can book through Hot Docs. So I'd be happy to field any further questions about that too.
All right. Anonymous asks, I've been tested positive, quarantined for 14 days, then test again, still positive after 14 days, booked for the vaccine. Should I or should I not have the vaccine while I'm still testing positive even after 14 days quarantine?
I can just talk to that in terms of, I'm not sure why you got another test. I'm not sure that would have been recommended, because you will throw off a positive when you get another test. So that goes sort of against what's recommended. What I would suggest to you is, once you've got your clearance notice through the department, which I imagine you have got through text message, I would book an appointment with your doctor first to discuss the time frame for when it's appropriate for you and your personal circumstances to book in for the vaccine, rather than just go ahead and have the vaccine.
All right. Anthony, booster shots, are they necessary? And if so, who should be lining up for them? And how long an interval should people be waiting?
Sure. There was an announcement from the Federal Minister for Health, Greg Hunt, last week of a booster shot program for those who are very immunocompromised, so have a very weakened immune system. And there has been some guidance about who would qualify for that, and it's very early days. So here in Australia, it's quite a narrow group of people that is being recommended.
Specifically, are we talking about Parkinson's, MS, those sorts of things? Is that right?
So if they've had an organ transplant or particular chronic conditions.
Cancer treatments?
Yes. So, and it's really early days on that. So for people who may qualify for a booster shot for instance, if they came to the pharmacy, we actually haven't been given the specific clearance and mechanisms on our claiming system to be able to give a third dose or a booster dose yet. So it's really early days. It is an evolving area. Overseas, there's been booster shots given in the US and the UK and Israel to people with a weakened immune system and workers in particular, healthcare and other settings. In Australia, it's really early days, and they're looking at it sort of could be 6 to 9 months even after the full dose schedule has been given for some people. So watch this space. If you're not sure, speak to your doctor and pharmacist as well.
Yep, I'd reiterate that. Yeah, it's very clear at the moment. So it's actually more a third dose than a booster. So for its people that have had cancer, active cancer, people that are undergoing immunotherapy at the moment, for people that have actually got severe immune therapy problems or low CD4 counts, for example. So it's a very narrow range of people. The advice from the federal government is go to speak to your GP about it. And it's 2 to 6 months afterwards, after your primary course, because actually those people don't get a high enough a level of immunity. So it's basically a third dose rather than a booster at the moment.
All right, and that's an important distinction. The language actually matters.
Yes, you're right. Yeah, absolutely.
So let's remind people that you can get the information you need from a number of places. You can go online, and the internet is full of official health information, but not some of the homegrown, sometimes I might say unreliable, and sometimes I might even say malicious information that is, for whatever reason, undoing the community response. Of course, coronavirus.vic.gov.au, if you're on the internet a lot and wanting to do it that way. But as each of our guests have already explained, any pharmacy, whether they're giving the injections or not, can give you information. Any doctor, whether they're administering vaccinations or not, can give you information. Any health intersection where you intersect with the health system, or your local council, the City of Yarra, have put on this forum and another one this evening to try and overcome some people's concerns. And these 4 experts here have been wonderful. Simon, Shobana, Laura, Anthony, thank you very much. We'll do it all again this evening for a different audience. So let's try and do what Caitlin in her question is effectively challenging us to do. As a community and on a community level, what can we do to encourage our friends, our families, our neighbours, our entire circle to go and get the vaccination? Well, one way we can do it is by, first of all, having good information, understanding that information, communicating it generously to other people. There's been some friction. Let's not pretend there hasn't been. It doesn't help. It doesn't help. Politicising it hasn't helped. Turning it into a us against them doesn't help. As we're reminded over and over again by all of our leaders in the community, whether they're leaders of faith or leaders of politics or sport or any other walk of life, the virus doesn't care who you are. It doesn't pick and choose. It will attack anybody it can get to. So you need to protect yourself and your loved ones and the rest of the community and everyone you encounter. So thank you to the City of Yarra. Thank you again to each of our 4 experts. Thank you to the many people in the community who have joined us for this particular forum. You get a chance to ask anonymously, but have your answers made public. And we'll, again, if you want to join the forum, we'll do it all again this evening. But that's all for this particular City of Yarra Community Vaccination Forum. Enjoy the rest of your day.